Is your diet silently making fatty liver worse? I've done the research, and what I found might change the way you eat forever. Let's break it down. When I first learned about fatty liver disease, I was shocked. It's not just something that happens to people who drink too much alcohol, it's often tied directly to what's on your plate. A friend of mine, who thought they were living a pretty healthy life, discovered during a routine checkup that their liver was struggling. They didn't drink, exercised occasionally, and weren't overweight. Yet, their doctor told them they had non-alcoholic fatty liver disease, NAFLD. How could this happen? That's when I started digging, and I realized this issue is far more common than we think, and much more sneaky. Here's the truth. Fatty liver disease affects around 25% of people worldwide, and most of them have no idea. Why? Because it's often silent. No pain, no obvious symptoms, nothing that screams, "Hey, your liver's in trouble." It's like a thief that works in the dark, slowly accumulating damage over time. And the worst part? Your diet could be the thief's partner in crime. Let me ask you something. Have you ever considered how the foods you eat every day, those seemingly harmless snacks, drinks, or even healthy choices, might be harming your liver? Take sugar, for example. Did you know that fructose, the kind found in sodas and processed snacks, doesn't get burned for energy like glucose does? Instead, your liver converts it straight into fat. It's no wonder high fructose corn syrup has been called a liver assassin in medical studies. And what about refined carbs like white bread, pasta, or pastries? You might think they're harmless if eaten in moderation. But here's the catch. They spike your blood sugar and insulin levels, triggering fat storage, not just in your belly, but in your liver too. It's a metabolic chain reaction that's easy to miss but devastating over time. Now, here's where it gets tricky. Some foods you think are healthy might actually be making things worse. Let me give you a real example. A coworker of mine used to drink fruit juice every morning, thinking it was a healthier alternative to soda. But fruit juice is loaded with natural sugars, without the fiber that slows absorption. It's essentially a sugar bomb for your liver. He didn't know it was hurting him until his doctor flagged elevated liver enzymes during a checkup. So, where does this leave us? What can you do to stop this silent damage before it's too late? That's what we're going to explore next. From understanding the symptoms of fatty liver disease to uncovering the foods that can heal or harm your liver, we'll tackle everything step by step. For now, think about this. Could the foods you've always trusted actually be part of the problem? Stick with me, and let's uncover the truth together. Fatty liver disease might sound complicated, but it's actually simple to understand. It's when too much fat builds up in your liver, often without causing any immediate pain or discomfort. Your liver, which works like the body's detox engine, starts struggling to keep up. When it's overloaded, that fat buildup can eventually lead to inflammation and even scarring, which we call cirrhosis. Think of it like a car engine. If you never clean or change the oil, it starts to break down. The same happens to your liver if it's clogged with fat. Here's why this matters. Fatty liver doesn't just happen to people who are overweight. You can be thin and still have it. It's often tied to what you eat and how your body handles it. The real kicker? By the time most people notice something's wrong, like feeling overly tired or experiencing discomfort in their upper right abdomen, the damage is already underway. Elevated liver enzymes, which can show up in routine blood work, are one of the first signs. But let me ask, when was the last time you checked how your diet might be affecting your liver? Let's get specific. Foods high in added sugars, especially fructose, are some of the worst offenders. They push your liver into overdrive, converting excess sugar into fat. A study published in the Journal of Hepatology found that people who consume high amounts of sugary drinks are at significantly greater risk for non-alcoholic fatty liver disease, NAFLD. Think about that next time you reach for a soda or even a so-called healthy energy drink. But sugar isn't the only villain. Processed foods, especially refined carbohydrates like white bread, pasta, and pastries, are another major issue. These foods cause rapid spikes in blood sugar and insulin, which encourage fat storage, not just around your waistline but directly in your liver. It's a vicious cycle that can quietly worsen your condition over time. What's even more surprising is that some healthy foods can be harmful too. Take fruit juice. It might seem like a better choice than soda, but it's packed with natural sugars that lack the fiber found in whole fruit. This means it hits your bloodstream fast, putting strain on your liver. I remember reading about a patient who thought they were doing everything right, cutting out sodas, eating more fruits, but their reliance on juice kept their liver enzymes elevated. They didn't see improvements until they switched to eating whole fruits instead. Now let's flip the script. There are foods that can help your liver heal and even reverse fatty liver over time. Healthy fats from sources like avocados, nuts, seeds, and olive oil provide essential nutrients without overloading your liver. Cruciferous vegetables, think broccoli, Brussels sprouts, and cauliflower, boost detox pathways, helping your liver clear out harmful substances. Choline-rich foods like eggs and lean meats are particularly important because they help transport fat out of the liver, reducing fat accumulation. But here's the big question: can diet alone reverse fatty liver? The answer is yes, but only if you make consistent, targeted changes. I've seen studies and first-hand accounts where individuals reversed early-stage fatty liver within weeks by cutting added sugars and processed carbs while focusing on nutrient-dense, whole foods. At this point, you might be wondering, how long will it take to see results? That depends on how committed you are to making changes. People often see improvements in liver enzymes and feel more energized within a month or two of shifting their diets. But consistency is key. If you're still sneaking in sugary snacks or refined carbs, the progress will stall. So let's come back to the main problem. Are the foods you eat every day silently contributing to fatty liver? If you're relying on processed snacks, sugary drinks, or even hidden sugar in healthy options like granola bars, the answer might be yes. But don't worry, change is possible. It starts with awareness and small steps, like swapping soda for water or replacing white bread with whole grains. These might seem small, but for your liver, they can make all the difference. Fatty liver disease is a condition where excess fat builds up in the liver, often without obvious symptoms. This accumulation can lead to inflammation and, over time, serious liver damage. It's concerning because many people are unaware they have it until significant harm has occurred. Common symptoms include fatigue, discomfort in the upper right abdomen, and elevated liver enzymes detected through blood tests. However, these signs are often subtle, making early detection challenging. Certain foods can exacerbate fatty liver disease. High sugar items, especially those containing fructose like sodas and candies, are particularly harmful. Refined carbohydrates such as white bread and pasta, along with trans fats found in many processed foods, also contribute to liver fat accumulation. To prevent worsening of fatty liver, it's advisable to avoid overeating, late-night snacking, and consuming low-fiber, processed foods. These habits can lead to increased fat storage in the liver. Sugar intake, especially fructose, plays a significant role in fatty liver development. The liver processes fructose into fat, leading to its accumulation. Studies have shown that high fructose consumption is linked to increased liver fat and inflammation. Surprisingly, some foods considered healthy might negatively impact the liver. For instance, fruit juices, despite being natural, are high in sugars and lack fiber, leading to rapid sugar absorption and potential liver stress. On the positive side, certain foods can support liver health. Healthy fat from avocados, nuts, seeds, and olive oil provide essential nutrients without overloading the liver. Cruciferous vegetables like broccoli and Brussels sprouts enhance detoxification processes. Choline-rich foods such as eggs and lean meats help transport fat out of the liver, reducing fat accumulation. Dietary changes can significantly impact fatty liver disease. By eliminating harmful foods and incorporating liver-friendly options, it's possible to reverse the condition. Consistency and commitment to these changes are crucial for success. In addition to dietary adjustments, certain nutrients and supplements can aid liver health. Vitamin E, omega-3 fatty acids, and choline have been shown to support liver function and reduce fat accumulation. However, it's essential to consult with a healthcare professional before starting any supplementation. The timeline for seeing improvements varies among individuals. Some may notice changes in liver enzyme levels and overall health within a few weeks to months of adopting a healthier diet. Regular monitoring and patience are key. Warning signs that fatty liver is worsening due to diet include increased fatigue, abdominal discomfort, and elevated liver enzymes. If these symptoms occur, it's important to reassess dietary habits and consult with a healthcare provider. By the way, if you're looking for a natural way to boost your energy, you might want to check out the surprising benefits of sweet potatoes. They're packed with nutrients that can fuel your body and keep you energized throughout the day. You'll be amazed at how something so simple can make such a difference. Don't miss out on learning why they might just be the perfect addition to your daily routine. In summary, being mindful of dietary choices and making informed changes can significantly impact liver health. By avoiding harmful foods and embracing a liver-friendly diet, it's possible to manage and even reverse fatty liver disease.